Good morning, friends. Welcome back to my YouTube channel Medical Classes by Dr. Srinidhi Kumar Acharya. Please don't forget to subscribe my channel and also please give your valuable comments. My dear friends, today we will going to start a new series of lectures which contains some of the very special and as well as very rare disorders related to pediatrics which is mentioned in Ayurvedic classics. Ayurveda classics, as they contain very rare and as well as important disorders related to Ayurveda pediatrics, which was not much focused. And in this series, we will try to explore such rare disorders which has got more clinical significance and which can be correlated with many of the present clinical situations. So to start with, today we will start with a very rare disorder which is mentioned in Ayurveda, that is Parvanuplava. Parva, Sthula Sandhi, Parva, etc. words are mentioned in Ayurveda. Usually this Parva refers to the joints or maybe the small joints. Now, Parvanuplava is one of the disorder which is mentioned in Ashtanga Sangraha Uttara Tantra, second chapter, the shloka number 112 to 114. Shiroho prushtaha tato mushko tatha padhau cha yo rujet hastabhyam uttitho vayu sa parvanuplava smrutaha. This is the explanation given by Ashtanga. Shiraha prushto tato mushko tata padau cha yo rujet hastabhyam uttitoho vayu sa parvanuplava smrutaha. So what is the meaning of this particular shloka? The shloka tells that this is one of the clinical presentation where the child start experiencing pain in the upper limbs in the beginning. The first child start experiencing pain in the upper limbs. It's not specified it is in the upper limb or upper limb joints. But as Parvanuplava Parva suggests to joints, we can take it as joints. So child start experiencing pain in the joints of the upper limb. This is because of the Vayu. Because all the pain is because of aggravated Vayu, as we know. So now aggravated Vayu now start creating pain in the joints of the upper limbs. And gradually this pain will spread to the other parts of the body like head and neck area. So this may be suggesting towards the temporomandibular joints or maybe some of the neck joints, vertebral joints. Then he says that this pain will then spread to the back area, maybe the vertebral joints, thoracic vertebral joint, lumbar joints or sacral joints, sacroiliac joints. And later he says that so this pain will going to shift to the testicular area, groin area or testicular area, and then the pain starts in the lower limb joints and as well as feet. That means the metacarpal and as well as ankle joints, navicular joints, etc. So if you look into the clinical presentation of this disease, it's very clear that pain starts from one point and later it go on distributing to the other areas, spread to the other areas of the body. And this pain typically shows a migratory in nature. So pain is migrating. That means pain is migrating means when the pain is there in the upper limb, usually there is no pain in the lower limb, but when the pain in the upper limb gets shifted to the lower limb, the pain in the upper limb usually disappears. But in another point of time, the upper limb joints may again start with the pain. However, the pain shows the migratory nature. Okay, migratory means this particular pain has got some relationship with that particular joint. Suppose if it's in the upper limb joint, take it as elbow joint, pain start in the elbow joint. Now child is having pain. After some days, elbow joint pain will go into subside and he will start pain in the neck joint. So when the neck joint pain start, there is no pain in the elbow joints, but After some time, again in the elbow joint, the pain may restart. So this type of presentation is called as migratory pain. Now, if you look into the migratory pain, the typical disease in the present contemporary science where we find the migratory type of arthritis or arthralgia, that is rheumatic heart disease or rheumatic fever. Rheumatic fever and rheumatic heart disease. Rheumatic heart disease typically shows the migratory nature of the fever. Why the rheumatic fever and rheumatic heart disease occur? So that is one of the autoimmune pathology. We know that initially there is involvement of the valvular structures of the heart, and later it gets converted into the rheumatic heart disease. Rheumatic fever, as a complication of the rheumatic fever, there will be rheumatic heart disease, and that can be assessed by the Jones criteria, major and minor criteria. And one of the major criteria of the Jones criteria is migratory arthritis. So this particular Parvanuplava shows the typical migratory nature. Okay, can we compare this Parvanuplava with the rheumatic heart disease? That's a different issue. But this type of migratory nature of the pain is seen in Parvanuplava. And rheumatic heart disease is very common in children. Therefore, Parvanuplava is also explained as one of the rare disorder of the children. Coming to the treatment portion of Parvanuplava, what Ayurveda Ashtanga says is a oil should be prepared for the Abhyanga purpose. Yes, he says that this has to be treated with the application of the oil, Abhyanga of oil. How that oil should be prepared? The oil should be prepared by using the drugs like Gauri, Vacha, Sadapushpi, Ashwagandha, Katutrayas, Katphala, 2 types of Vartaka, Vayastha, Hingu, Rohisha, Ajhamutra and Sura. If you look into the drugs which are mentioned here, the drugs which are mentioned are Vatahara in nature and also Vedanahara in nature. So this oil is prepared according to the Taila Vidhi, and this is used for the Abhyanga. Other treatment principles which are mentioned for the same clinical condition is treatment principles of Vata Vyadhi. Any treatment principle related to Vata Vyadhi can be also adopted here. The drugs like Hingu, they are basically Vatanashaka. Similarly, there is Vartaka, Katphala, Katutrayas. Okay, so there are so many Dipaniya, Pachaniya and Brahmaniya drugs are also present. Along with that, Vatanashaka drugs are also present in this combination. Vacha like Lekhaniya drugs are also present. So in total, so this is the treatment principle which is explained for Parvanuplava. So this clinical presentation can be compared with the present day concepts of rheumatism, where we find a migratory type of arthritis. Migratory type of arthralgia or arthritis is very commonly seen in rheumatic heart disease. And when we have got this type of shifting or migrating type of joint pain is there, usually that condition is referred as rheumatism. Rheumatism, which has been explained 5000 years back in our Ayurveda science. Thank you very much. Please don't forget to subscribe my channel. Again, we will meet with another important disease of Kaumarvritya. Thank you very much.